Hi, I'm Debbie Stadtler, Editor-in-Chief of Provider Magazine. Today I'm joined by LaShuan Bethea, Executive Director of the National Center for Assisted Living. Welcome, LaShuan.
Thank you for having me.
Absolutely. Well, let's start. Why is advocacy important?
Advocacy is extremely important. Not only does it give us an opportunity to educate our members of Congress on what is assisted living, how is it different from other sectors like skilled nursing or home health, but it also allows us to explain to them what the impact of decisions that they are making in DC on individuals, not only owners and operators of assisted living, but residents that live in assisted living communities all across the country. So it is a great opportunity. It allows us to give our residents a voice that they might not otherwise have. So advocacy is extremely important.
Why advocate for assisted living at the federal level when it's much more state regulated?
So that's a great question. While assisted living is primarily regulated at the state level, there are priorities, there are regulations that at the federal level that do impact assisted living. And again, it's important that we make sure that members of Congress understand any decision that they make at the federal level, what impact is it going to have to residents and assisted living providers at the state level. And I think a prime example of that is Medicaid. Everyone is really familiar with the fact that assisted living is primarily private pay, but that number is changing in some aspect. There's a growing number of individuals that rely on Medicaid. In fact, 1 in 5 residents in assisted living rely on Medicaid to cover the cost of their care in that setting. And so, again, it's extremely important that this trip here to Washington, D.C. is important to make sure that our members of Congress understand how Medicaid actually impacts residents living in assisted living.
That's a great example. Well, in general, what are NCAL's policy priorities for this year?
So assisted living is growing by leaps and bounds. And so as we think about more and more seniors accessing the assisted living setting, probably the number one priority is who is going to be the caregiver, who's going to be the individual that is working in these assisted living communities, providing the care to the residents that are living there. This is extremely important as we think about the number of unpaid caregivers or family members is actually shrinking. The number of individuals, family members that are providing care to residents in their homes is actually shrinking. So those individuals are going to assisted living. And so we need individuals in assisted living to provide those care and services. So workforce is extremely important. We are also focused on quality. We know that assisted living providers across the country are extremely focused on quality. They're participating in our NCAL Quality Awards program. In fact, last year we had over 215 assisted living providers receive a bronze or silver quality award. So again, we're focused on that. We know that providers are focused on quality as well. Population health is another thing that we continue to be focused on. We know that population health looks at outcomes in different settings, and so we're looking at making sure that providers are not only aware of the role that population health plays in assisted living, but how to integrate population health into those settings. So those are some of the things that we're focused on. The last thing that I'll mention is that we are also focused on reasonable regulation. We want to make sure that any regulation that is passed or has an impact on assisted living, that it takes into consideration not only how providers are impacted, but also how residents are impacted in that setting.
I think that's super important, not only the businesses and the organizations, but really the people every day that are in the facilities.
Absolutely.
So how can providers get involved with advocacy?
The number one way that providers can get involved is build a relationship with your member of Congress. Not only coming to DC to introduce yourself, to talk about your community, to talk about what your residents are saying are important to them, but also inviting them to do a community tour. Let them meet the residents, their families, even the employees, to talk about what they do on a day-to-day basis. I talk to providers all across the country. They tell me the things that are important to them. workforce, reasonable regulation that's going to allow them to continue to provide quality care to their residents, and quality of care and services. These are the things that are most important to them, and it's important that they allow their member of Congress to know that these are their priorities. So advocacy is extremely important, relationship building, and inviting them to their community to do a community tour. Extremely helpful. That's how they can get involved.
I love that. It's not necessarily about the issue today, but about building that sustainable relationship and really providing the education and information.
Absolutely. They are a resource to their senator, and so, or their member of Congress, any member. So they should make sure that they know that.
Wonderful. Thank you so much for being with us today, LaShuan.
Absolutely. Thank you for having me.
Thank you.